Welcome, ladies, to the Strong Mom channel. We've got Dr. Sinead Dufour with us today. I'm going to introduce her, and we are talking all about pain. Dr. Sinead Dufour is an associate clinical professor in the Faculty of Health Science at McMaster University here in Ontario. She teaches and conducts research in both the schools of medicine and rehab science. She's a pelvic health physiotherapist, and she brings her research in pelvic health, birth, and pain science that she shares at conferences and journals to us on her Instagram page. And that's what we're talking about in today's video. She is also a mom of twins. And today, doctor, I really want to delve into the pain that a lot of moms experience in pregnancy and postpartum, and how the research that you've done actually tells us that what we believe and what we tell ourselves is more relevant than our biomechanics when it comes to things like pregnancy pain, recovering from birth and C-section. So ladies, I want to repeat that. Dr. Sinead is telling us that pelvic girdle pain, that SI joint pain, that low back pain you've got has more to do with your beliefs than your actual body structure or the function of your body or the way that you move on a daily basis. So Dr. Sinead, I know that a lot of moms are watching this and say, you are not gonna psychologically explain away the pain that I've got and I'm experiencing as a pregnant mom or postpartum mom. And you posted this on IG with the quote, pregnant picture with the quote, "Of course your back hurts, you're pregnant." And you wrote, "This is the biggest crock ever." And I think that is so funny. So let's talk about this, because many of us think that because of our back pain in pregnancy lies in our poor lifestyle habits, such as sitting too much, hunching over the computer, poor posture, and the relaxin hormone, right? That's explains everything. The relaxin hormone that makes us all loosey-goosey in our joints. But you're telling us today that your research has refuted this, or maybe shines a different light on it. And you're telling us that pregnancy pain is, in fact, lies in the psychosocial domain. So Dr. Sinead, please do tell us more about this. And the mamas who are out there saying, "But I've really got pelvic pain, and I'm seeing the chiro, and I've got a massage appointment, and I'm seeing my therapist. So you can't tell me that my pain is not real." Right, Dr. Sinead? So tell us all about your research.
Yeah, absolutely. So, first, what I would say is that comment, beliefs are sort of more relevant than biomechanics when it comes to pregnancy related pelvic girdle pain. I have to say, I've taken a lot of flack for that. But the reason why is because people are misinterpreting what that means.
Okay.
From my context when I say it. So let me kind of explain that first. And you so nicely kind of pulled in a lot of the things that we really do need to myth bust around.
Okay.
But let me explain that first. And let me, even before I do that, highlight that when, an academic or a clinician who's very up to date on the science makes a comment around beliefs being so relevant to the pain experience, that is not saying that the pain is psychological or in your head. So let's just clarify that first, because what we do understand is that our social context and our cognitions modulate our biology. So at the end of the day, yes, the tissues are affected. Your motor programs change. The tissue piece is relevant, but it's the end point. And so it's almost like the concept of if you had a plant that had a number of leaves and a couple of the leaves were kind of turning brown. And if your focus was only on the leaf,
right,
to restore, the integrity of the tissue of the plant, you wouldn't get very far. Would it maybe help a little bit to expose the leaf to sunlight, to spray some water right on the leaf? Sure, that would help a bit. Right. But what would be much more relevant is going upstream to the soil. Gotcha. And really getting to the root of it, what feeds the tissues. So what we're saying is beliefs modulate your physiology in such a profound way that it is your physiology and it feeds your physiology and it feeds then your tissues. So we're not by any stretch of the term saying the tissues aren't impacted or that they are not relevant or that, a massage isn't going to be helpful. It is, But if that's where you're focusing and you're not really getting to the root of it, you're just not going to get a full recovery, and you're not going to get it very fast. Right. So that's kind of more what we're saying, just to kind of put that into context.
Great.
And then what I would also say is, yes, I've conducted some of my own original research in this area, but more of what the research I've done is actually kind of scoped and followed the history of where the data has gotten us. So it's kind of more of like a knowledge translation piece. And this is, of course, what I teach both at McMaster and then for some private companies.
Right.
But let's kind of talk about that, about, it's not all about the tissues and kind of, where it comes in with the belief perspective. Right. And what I will say is these principles I'm going to be talking about, much of them actually applies to musculoskeletal pain across the board. Okay. It's just that we have some specific contextual things when it comes to the pregnancy related piece, right?
Right.
So you're quite right. We have been led to believe that, it's about our posture, our way of lifting, this relaxin hormone making things too loose. And these are all the reasons why we experience pain when we're pregnant. And what we actually see, though, in the literature and with the women in front of us is that those women who truly are kind of presenting with a pregnancy-related ache or pain that might be more related to sort of a tissue issue, it usually resolves very quickly. Oftentimes, these women are able to say, oh yeah, my hip is a little bit sore. I think I might have overdone it. They can throw a heat pack on it, rest, and then the next day they're better. Right. Or they can kind of book a massage, they go, and after that they're better, like they're good. Right. That is actually a very different clinical picture than the 50% of women who have this debilitating, persistent pain presentation, that they get to the point that now they're extremely worried about how on earth are they going to birth this baby out because of the pain experience they're currently having. How on earth are they going to care for a baby when they can barely even care for themselves when they're pregnant because of this pain situation? They're even thinking they have to try to get off work. So we already see, like, from that clinical picture, there are all these different systems that are brought into it, right?
And what percentage you say with
so it's 50% of women have pregnancy-related pelvic girdle pain. Right. And when we're talking about pregnancy-related pelvic girdle pain, we are talking about this group that has this highly sort of debilitating, the pain isn't going away from when they see their massage therapist. Their pain, right? This is what we're talking about. Because the other group of people who kind of have the odd ache or pain, or they go to the massage therapist and it works. They only need like a session or two, then they're good for a couple months, then they go again. Yes, likely that mostly is a nociceptive input. And that can be taken care of with our traditional methods, but that's a small proportion of people, especially those people coming to us saying, no, I've literally had this pain since my 16 weeks. And now they're 24 weeks. Right. Like, this is what we're talking about. Right. Those are the people where the peripheral strategies aren't going to cut it. So yeah, the longer you have this situation, for example, with the plant that has a couple leaves going brown, now more are, well, now it means there's just more remediation we have to do with the soil, right? So we probably have to get water and maybe special plant food and really get that out into the sunlight. And maybe we actually have to start getting some other supports to support the leaves that are kind of coming down. Like, there's just more that we have to do. Right. So the same goes when we have a manifestation of dysfunction in our tissues that's persisting like that. We have to think, oh my goodness, now our systems and our pain system, it's designed in a way really to protect us. But when it's maladaptive, so when it's kind of been going on and it becomes hypervigilant for too long, it gets better at doing that. So it gets even more sensitive. So then your brain starts to interpret tasks that really shouldn't be interpreted as a threat, as threatening. Anything that is stimulating the mechanoreceptors of the tissue, now the brain is going danger, danger, danger. Right. And then an output of pain comes out, right? So
even before you've done it.
Even before you've done it, because the brain is set up with pain to actually be pretty smart and anticipatory, right? So if you were walking down a dark alleyway and you got mugged, right?
Mhm.
Your brain is going to remember that context.
Right.
And whenever you are walking down a dark alleyway again, if you hear a sound or if something happens, your brain is going to go into danger mode. Nothing's actually happened. You hear footsteps behind you, your brain is going to go into danger mode, even if it's your best friend behind you.
Right.
Right? So the brain is anticipatory, and it's like this for a reason, to protect us when we think of evolutionary biology. But the problem is when we don't understand the other factors that are driving up this
Mm.
hypervigilance,
Right.
we can get really stuck.
Right.
And that hypervigilant state can get driven up when we're not sleeping very well.
Mhm.
It can get driven up if we're thinking, my goodness, I'm really actually scared of this upcoming birth. And actually, one of the things we see is there's huge literature base highlighting, the fear around birth.
Mhm.
In our culture, unfortunately, the way we do birth doesn't align with the research, and that's a whole other conversation. And even the way birth is kind of displayed from a media perspective, it is displayed as something that's scary, that's
Yeah.
painful, that's medicalized,
Right.
that's frightening, right? And so
Mhm.
we're starting to see, yeah, pregnancy related pelvic girdle pains. I'm not talking about the aches and pains that are easy to correct. I'm talking about this other manifestation that happens much more predictably in the second pregnancy versus the first.
Right.
It's another reason why we can kind of look and say, okay, well, if this truly was about the mechanics, if it truly was about relaxin, if it would probably affect all women, and it doesn't.
Right.
It would have probably affect the first pregnancy, second pregnancy, third pregnancy, fourth pregnancy the same. It doesn't.
Mhm.
It consistently doesn't impact the first one the way it does subsequent ones.
Right.
We know when we look at the clinical practice guidelines from 2017 that a clear risk factor for this pain is a previous trauma.
Mm.
Well, we also know that 68% of women, when we kind of triangulate all the data, really do report some form of trauma, be it either physical or emotional, after their first birth.
Mm.
Right? So we have to start understanding, well, how does the threat response system actually work? And what actually produces a pain output in the first place? And this
Right.
is just general pain science.
Right.
And that science has morphed, huge in the last decade. And then when we apply that to, yes, well, it makes sense, this context of trauma and hypervigilance and
Mhm.
pain output and, lowering the threshold that the brain would interpret threat,
Right.
and a previous birth trauma. And when we think too of women who are actually going into their second pregnancy, and we think of their energy system, I mean, these are women usually who are caring now for a toddler,
Mhm.
who weren't nearly in the sort of state of physiologic reserve going into that second pregnancy as they did their first,
Right.
because they went through all the depletion in the postpartum period of being sleep deprived, breastfeeding. And I mean, once you're a mom, like, you're on,
Yeah.
like, you don't stop,
All the
right?
time.
And
Right.
all our listeners, right, can resonate with that. You are on. So even if you feel like, yes, you've kind of gotten back to your routine, you've gotten back to work, you've gotten back to exercise, you've gotten back, still chances are you're not nearly, have as full of a tank that you did before that first time.
Right.
And so, when we think again, the threat response system goes off more when our energy is low, when,
Mhm.
when our tank is low. So there's another classic reason, but oftentimes women aren't thinking about their energy system and what is that actually doing to their threat response. Once your threat response goes off, that actually does change your motor output.
Right.
So it will change how you move.
Right.
And so, yes, the mechanics are relevant, but not really the way we've thought. It
Right.
really isn't about correcting upslips or downslips and let's get you just more stabilized. And no, we certainly want to improve motor strategies.
Mhm.
Absolutely. We
Mhm.
know there's a lot of co-contraction. We know that there's a lot of pelvic floor high tone, because that
Mhm.
is a highly protective muscle that's
Right.
connected to our threat response system. And if our pelvic floor is locked like this and can't properly participate, in the collaborative dance with the transversus abdominis and the lumbar multifidus and the diaphragm, I mean, forget it. Your motor programs are going to be off,
Right.
right? So, I mean, this very much, just to kind of kick us off, and then I'm sure you'll have follow-up questions. This more is the basis of what we're talking about. So
Mhm.
it isn't to say it's in your head and it's all psychology. Absolutely, it lands in your tissues.
Right.
It's just, we need to contextually understand how it's in your tissues, and we need to travel back so women understand about their sleep, about their energy system. Are they trying to exercise, at the end of the day when their energy system is done, and now they're wondering, why is it painful when they walk? When a simple change of go for your walk first thing in the morning.
Right.
Energy system is good. Your mechanics are the exact same. You are going to find it's a totally different experience in your body. And it's just helping us to understand we need to think of all the systems. And does that mean there for sure isn't any reason to maybe go to a chiro or physio? Of course, absolutely. Go to those people. There is going to be an impact on the tissues, and for some people more than others, but don't get distracted there. And when you're going to your chiro and you've been going there now for 12 weeks and you're getting like a day's relief from your symptoms, and then you're feeling like you need to go again, I mean, that's a clear sign that you are not getting to the root of the issue. No one should have to spend that much time in a healthcare practitioner's office. That's crazy. So yeah, that's probably where I'll just stop momentarily, because I'm sure you have follow-up.
Yeah. And I think you're right. Like, people will say, I have to go to the chiro because she fixes me. She makes me feel like this, right? Or I'm trying to get to this result. And so we put our trust in that practitioner that, yes, they can help us, but it also comes within us, right?
Yes.
So what are some of the things that you get your clients to do that's within them, right? Sleep, movement at, change around the times of the day. I know you talked about some of the other psychosocial factors were lack of job satisfaction, smoking. We talked about the trauma, and lack of expectation for improvement. I think that's a big one. And I see that with my clients too. Oh, for example, I gained 10 pounds again, and that they're just kind of stuck, right? And that keeps them stuck. And we can, relate that to the pelvic girdle pain as well. Oh, I have this pain and it's been like this for 12 weeks. I'm not going to do anything about it. Right. So how do you help your clients, and how can we talk to the moms out here? How can we, I don't want to say get it out of your head, but what can we do to help ourselves?
Yeah. And this is honestly where I feel like trainers are such powerful allies in this space, connecting with women, working with women. You already have such a great sort of therapeutic alliance and a degree of kind of trust. And really, these people are interfacing with you usually because of their desire to want to move, right? But just them feeling like, yes, but when I move, it hurts. And then oftentimes that goes with the belief that that must be dangerous, and they don't want to cause damage, right? So really, where we have to step it back, and any single person interfacing with women in this space, this is within your scope, right?
Yeah.
But really, we have to get women first to understand what the pain is actually all about. So it's important that we do some work there. We know that women will not change their behaviors if they don't adjust their beliefs, right? If we can't get someone to understand that it isn't damaging to walk, even though they're feeling that sensitivity in their tissues, right? We're not going to be able to get them walking. Like, we just aren't. So really, we have to kind of start at that level. And so usually where I start is I will kind of start around some of those things I highlighted that might sort of question their beliefs around, okay, but if it really was all about relaxin, I mean, we have data that shows us that it's not. But if it was, like, if it really was, why is it that it only affects this many people?
Right.
If it really was, why is it that many women have no issue in their first pregnancy and they do their second pregnancy? Like, if it truly was about, truly the mechanics of your size and the weight, if it was about the weight and the mechanics and relaxin, we know mamas who are pregnant with twins, and that of course was me, have over threefold the amount of relaxin, and they have over double the weight, because in many cases, I mean, I had 2 babies, 2 fluid sacs, 2 placentas, 2, and so why is it that that group actually has less? pregnancy-related pelvic girdle pain. So sometimes by presenting some of this information, and this is why it's critical that trainers are informed and they do have this knowledge, because if you say, like, if it really, like, how do we explain that? And how do we explain right now, I want you to walk forward 5 steps, and then I want you to walk backwards 5 steps. And oftentimes we find walking backwards, it's a totally different experience. Usually the brain, it's a novel movement, isn't anticipating that that's going to be threatening.
Right.
And so the tissues don't automatically get that extra degree of tension and sensitization in them. You don't get that kind of hypoxic reaction of less oxygen, right? Because nothing constricted. And so then it doesn't hurt. And you say, like, how do we explain that?
Right.
And so you really do, I believe, need to kind of highlight, well, if we have this, then how do we explain this? If we have this, how to get people thinking a bit outside their box and maybe starting to get them to be open to buying in. But most people won't buy in until you change their experience.
Right.
So this is one of the first things after I'm done engaging with someone, they're in my office, or even if I'm doing it virtual, I can kind of talk them through this, right? Is I get them to do movement that they can literally experience a dramatic change in their body that questions then their beliefs. So if they're coming in and saying, well, no, I know it's just that my core is weak, because as you said, women are so good at shaming themselves, right? I didn't get onto my exercise plan after I had my first baby. Like, I didn't go back to exercise. I know my core is weak. I didn't properly restore my pelvic floor after my first thing.
Right.
So I went and I know my core is weak, and we know that this has nothing to do with core weakness. I'll say it again.
We're going to talk about that in a bit.
With core weakness. So we'll come back to this because that's a big one, right? But women think it, right? And they'll come in. So, we know that if truly we are going to strengthen and develop fitness in tissue, that does not happen in 5 minutes, right? That takes like weeks for that to happen, right? So a powerful way to sort of question that belief, or have a woman start to question, maybe I do need to think about this differently, right? Is by getting the pain experience to be dramatically different within the session. And this is absolutely something trainers can do. So, the walking is one thing, but another thing I will often do is I'll have the woman lying down, and they'll do what we call an active straight leg raise test, right? And this is a test that many trainers do as well, right? And really we're looking at the woman just lifting up their one leg, lying on their back. And what we're trying to determine is, how easy was it to do that, right? With how much ease did you do that? And oftentimes women who have pregnancy-related pelvic girdle pain, they have so many motor patterns that are off, so much co-contraction, that a task like that is difficult to do. It's like your leg is lead, right? But then when we say, okay, how easy was that to do? And oftentimes we'll be like, that was hard and that hurt. Like, that pulled my sacroiliac joint. So they'll have that experience. And then if I say, okay, well, why don't we kind of do some movement, and then we'll do that again. And I have a very kind of specific novel movement sequence that I do with clients where, they're thinking about their breathing, they're bringing their legs into butterfly, they're coordinating that with a few repeated movements that are gently engaging the lateral structures of their hips. Then they move to some movements coordinated with their breath that they engage sort of the medial structures of their hips. So it's very deliberate in terms of what I'm doing, but I'm
and
also
the way that you say it just makes me feel like this.
Totally. And I'm right there with them, either on the screen, talking them through it. So they're usually feeling pretty safe. They're thinking, oh my goodness, she's asking me to go into butterfly. Like, I was told to keep my legs together. And so like, even that's a bit of a, okay, but I sort of trust this person. So, okay. And if I'm there with them in person, it's even better, because I can kind of have my hands on them and guide them through. So we take them through this very basic sort of sequence that takes a couple minutes. And I say, okay, so let's now just kind of try to lift that straight leg raise up again. And it's dramatically different. And that then is oftentimes sort of a bit of a linchpin for them to say, oh, wow, I'll say, see, so absolutely, we changed how your muscles were behaving, for sure. Your muscle behavior is part of that, right? But it's not because it's inherently weak, because we didn't strengthen you in these 5 minutes. We
Mhm.
put different inputs into your system. We created safety. We brought oxygen on board. We did a whole bunch of things that then actually your tissues could behave in the way they're meant to,
Right.
right? We got a lot of the barriers out of the way
Mm.
because really that's what we have to do. You made an important comment before, Denise, around for the most part, when women are given some guidance, and some of that guidance can involve some safe hands on touch, that will help motor programming for sure. Some of the guidance is movement, some of the guidance is better sleep, right? So, yeah, guidance I think is important. Women shouldn't be told they have to figure this out on their own.
Right.
But with guidance, what really is needed is everything they already have inside. It's
Mhm.
just a matter of removing the barriers and kind of nudging them down the right path.
Right.
But then they have everything there already,
Mhm.
right? And this is why I feel like the best people to help women in this position are really practitioners and fitness providers, very much coming from a coaching perspective
Mhm.
and not a fixing perspective.
Right.
So when I'm engaging with pain, off goes my kind of traditional practitioner hat and on goes my health coaching hat,
Right.
right? Where
Or
we're really working alongside, right?
right. Right.
Yeah. So, I mean, I really do think, yes, the first thing you need to do is flag and help them to maybe see one, that their beliefs aren't correct, but two, that they're actually keeping them stuck,
Mhm.
right? But then, talking to someone on that level often isn't enough. They need to feel it in their body.
Yeah.
They need to have that experience so they think, oh my goodness. And then maybe they're listening a bit more. They still
Mhm.
might not be convinced
Right.
until, it's really proven to them, right?
Right.
But
Right.
at least they might be on enough to say, okay, you know what? I'm going to make some micro shifts in my thinking.
Mhm.
I'm going to make some micro shifts in my doing. And usually that's all it takes,
Right.
micro shifts. And then they start doing so much better and so much better. And then they're coming back and saying, yeah, like here I am now at 36 weeks pregnant. When I first met you at 18 weeks pregnant, and I'd been struggling since like 14 weeks pregnant, my belief was that this issue was going to get worse and worse and worse and worse
Right.
because the moving target of pregnancy was the etiology of it.
Mhm.
And really, I was hoping at the very least you could help prevent it from maybe getting any worse and helping me to maintain.
Right. Right.
But now I'm at this situation at 36 weeks pregnant and I'm so much better than I was before.
Right.
And now I'm really looking forward to, okay, forget about how I'm going to do during my pregnancy because I've already done that well and I'm great with that. How am I going to have an amazing birth and recovery?
Right.
And
Right.
then we can kind of shift our thinking. And I
Right.
mean, the research tells us this, but I see it play out in my practice every single day. The
Mhm.
fact that I'm following this new way of understanding this issue, that again, I didn't make this up, right?
Yeah.
This is what all the literature says. It's just so incredibly effective. And every single PT trainer, doula, midwife who takes my course and starts applying this, I mean, I'm getting emails all the time of, oh my goodness, it's so incredible that it's so much less complicated. It's so much more empowering and
Mhm.
it works so much better, right?
Yeah. Yeah. So how would one, and you work one-on-one with moms as well,
Yes,
right? And like you said,
yes, yes.
so I guess my next question was going to be, how does one find a practitioner like
Mm,
you who has this knowledge and of the beliefs, right? And so I think moms will go to maybe a chiro or a physio, and like you said, try to find somebody who is maybe holistic or
yes,
kind of in nature, or a health coach, something like that, who has a more holistic view and not just the pain and I'm going to do this.
yes, absolutely.
Right.
So this
Okay.
is a great question, like really and truly, because not every doctor is the same. Not every OB is the same. Not every midwife's the same. Not every trainer's the same,
Mhm.
right? And it unfortunately does put some onus on us as the health consumer to make sure we are connecting and spending our time
Mhm.
with the right type of person who's
Right.
actually going to take us across the finish line fast and properly and effectively, right? So, a couple of things I would say on that line is, I mean, certainly if you are in the Canada area, Pelvic Health Solutions
Mhm.
is probably one of the lead, certainly not the only, but one of the lead, I'd say, training agencies for pelvic health
Yeah.
physiotherapists, right? So if you're thinking in your mind, pelvic health physio is kind of someone you want to interface, and I would argue that would probably be a very useful person to address part of this problem,
Right.
right? And actually to address a whole bunch of things that might be going on in pregnancy to prep for birth and recovery. Because really, we don't treat conditions. It's not like I treat pelvic girdle pain. I care for women, and women might be coming with, frustrations around this awful pain experience, but they also want to prevent themselves from getting diastasis. They also, they come with all these things, and I'm going to help them with all those things, right?
Right.
So there'd be a lot of reasons why, a pelvic health PT, and a good one, might be part of your team, right?
Yeah.
But you really do want to make sure you have someone who has a lot of pain science courses under their belt. And the nice thing that Pelvic Health Solutions does that I don't believe any other listing agency does is they list the courses that these PTs have taken.
That's what I love, that site. Yeah.
Right. So you can kind of get a sense of, well, is this a pelvic health PT that literally has just kind of taken their level one, their most basic training to be allowed to call themselves that? That's going to be quite different than someone who has been doing this for years, has all the pain science, has all the pregnancy specific courses, has all. So that's one way of teasing it out. With the other provider groups, what I think is oftentimes a great litmus test is really honestly how they're even going about their sort of what we call like the subjective, the interview part with you. You'll get a good gauge based on if it feels like they're asking just a lot of closed-ended questions. They're not asking a lot of open-ended questions to really understand your context. Right. Well, what about the sleep? And what actually went down in that first birth? Like, tell me about it. Like, we have time. Tell me your story. Tell me about it. If you're working with a practitioner who's not doing that, and it's a lot of closed-ended questions. And when you're talking in terms of this really being an issue, primarily speaking about musculoskeletal mechanics, and there's no dialogue to even attempt to explore the other factors, to me, that would be a bit of a flag. And does it mean that you won't get something beneficial out of that one encounter? No, you might get something useful out of that one encounter because you will get sort of a fixer mentality right on the tissues. But I would say then you've probably extracted all the benefit you're going to need. And there's really no need to circle back with that individual again. Right. So that's probably what I would say about that. I think that's probably your best bet and your easiest bet when it comes to any type of pain experience. Right. And this is, we've kind of been talking about pregnancy related pelvic girdle pain, but you made the other comment about like after birth, and we've had a cesarean and now we're having this persisting pain. It's been 4 months and you certainly weren't expecting that, so anytime we're dealing with a pain experience, we have to be thinking about that soil and leaf analogy. We have to. And so we have to be thinking about all the systems that have kind of impacted that threat response. And it means for a clinician to be a really good coach and guide you, across the finish line, in the smoothest way possible. They need to understand all your unique context. And for them to do that, they need to let you tell them. They need to let you talk. They need to, right? And so if that's not happening, then, where the limitations in that encounter are going to be.
Right. Okay. So you talked about postpartum and C-section. So I want to make a quick transition here to postpartum pain, postpartum recovery pain, and including C-section. So what are those, what constitutes poor postpartum recovery?
Yeah, this is a great question. So, what can be really, really frustrating, when you're someone like me and you're teaching about this, it can be frustrating when we don't find like clear-cut data of like clear-cut timelines and clear-cut. And this is an area where it can be really fuzzy, but in ways it makes sense because actually the healing is so context specific. So let me kind of pull that back in a way that, people have some tangibles to take away. So what we do know is we understand that when it comes to postpartum recovery, we have this initial phase, which is called like our acute phase. And it's kind of up to the first sort of 24 hours.
Mhm.
And this is where we have like rapid recalibration of our like hemodynamics, right? We have just birthed a baby. We have just birthed a placenta, which is essentially a hormone factory. I mean, there are tons of massive system wide adjustments that have to happen, right?
Yeah.
And so, this is why, if you've had your baby in a hospital or a birthing center, you will have to stay and be monitored. It's not like you birth your baby and then off you go home. You're there being monitored for a number of hours after. And this is why. This is to kind of get through this initial stage. If you've birthed at home, your midwifery team, your two midwives are going to be staying there until you're kind of, okay, now we feel like you're kind of stable out of that. And now we kind of move into the second phase.
Right.
And the second phase of recovery goes up to the first 6 weeks.
Okay.
And so again, approximately, right, 4 to 6 weeks. And that makes sense because when we understand tissue repair and tissue healing properties, I mean, if you go back to all those old textbooks that I'm sure all of us kind of had to learn at some point in our undergrad degrees, tissue healing, you go through the remodeling of tissue healing, it's about 4 to 6 weeks, right? So this is kind of, we're getting ongoing recalibration of our endocrine system through this time, but we're also getting this tissue healing, right?
Yeah.
Because I mean, even in the best circumstances, right? A woman is empowered and able to, because some things aren't under our control, right?
Mm-hmm.
But a woman is a situation where she's empowered to and she's able to birth in the setting she wants, the way she wants, in the position she wants, with the pushing she wants, all of these things. She births her baby. There's no tearing. There's no sort of emotional trauma. Actually, it's a really amazing, empowering experience. So even in a situation like that, where we'd say that's a really awesome outcome,
Mm-hmm.
we also still know that the tissues still need to heal, because even just by stretching of the pudendal nerve, which supplies the pelvic floor, we know that if that nerve stretches even 15%, some of the axons inside that nerve will tear.
Okay.
Right. And so now we're going to get what we call a little bit of denervation to the pelvic floor. We're going to have stretch and swelling of tissues that has to come down. I mean, there's still tissue recovery that has to happen, even if there was no surgical cuts or tearing. Right. So we have that next period. And that's why at the end of that period, usually that's when someone's interfacing with a healthcare practitioner, right? Usually you'll see your OB or midwife at that 6-week point. I usually suggest I see my clients between 4 and 6 weeks, right? So we're at that point. Then we have our next phase of healing, which we call the fourth trimester. And it's called the fourth trimester for a reason, because it's to acknowledge, look, it's not like once people are 6 weeks, like they're all healed and we're good to go. That's that kind of main subacute sort of phase. But there's still ongoing recovery in a pretty intense way until that sort of 3-month mark. And then we kind of have our next stage of healing goes to the 6-month mark. Like that's kind of generally how we think of it, right? But the reason why the data is not as clear as we would like is because the recovery is so context specific. And that's important for us to have these kind of general timelines, which are helpful, right? So we know, for example, with return to running, well, the return to running guidelines indicate not until after 3 months, even for avid runners. And at that point, it's actually only if your context is if your pelvic floor is strong enough, is if when you jump, you don't leak, is. So it's still an if, and some people might not be ready till 6 months, right? So everything is still context specific, but at least we still have some guidelines there. What are some key things that impact someone's recovery, right? Well, support. So women who are kind of at home, they literally have zero support. The other parent of this child is just very busy, maybe for good reasons, maybe not so good reasons. Maybe it is just them. There is no other parent in play. Maybe they have. So oftentimes lack of support in this time, the data shows us it tracks to poor recovery, and we see it play out in practice every day. Right. Oftentimes less support also goes hand in hand with less rest and less opportunity for physical recovery.
Right.
Because oftentimes when you have support, like you have someone else there say, no, you go rest, go take a nap. I'm going to take baby, and this other person's going to get dinner made. Right. Like you have support. So it's not just you with this finite amount of energy that is trying to shunt to heal tissue, that's trying to shunt to produce breast milk, that's trying to shunt, and you have no reprieve to recharge your battery, right? So not surprisingly, if we do not have basic raw materials to recover tissue, we cannot recover it very well.
Right.
So if we aren't eating nutrient-dense food, if we are not getting reparative sleep, if we are not spending any time kind of peacefully in the parasympathetic side of the nervous system, that's your rest and digest side, and you're in this hypervigilance all the time, tissue doesn't recover.
Exactly.
So again, this is where it can come back. Like if there was any type of trauma that happened that sort of locks mom into this like hypervigilant mode, see that correlates with mom almost really developing this very accelerated protection response with baby, and almost developing attachment to the side of, if we think of that inverted U hypothesis, and we kind of want everything to be at that like Goldilocks position, right? Too little is not helpful. We need a good amount, but like too much is also not helpful, right? And the same principle applies for almost everything in life, right? There can be too much of a good thing. There can be too much of a good thing of needing to be like hovering and connected with your baby 24/7, and never getting that opportunity for just like physical space to just be. And so, I mean, this can be another factor, so there really are so many factors that make a lot of sense when you understand the biology that are going to dictate the healing. So if someone comes to see me at, let's say, 8 weeks, because were supposed to come at 4 weeks, but they actually pushed that because they were feeling they weren't even remotely ready to see me at 4 weeks, and they'll come at 8 weeks and they'll even be saying, yeah, like I kind of pushed this visit. And even now I was almost going to push it again because like I'm still in so much pain where my episiotomy was. I still can't sit. I'm actually starting to have pain everywhere. I think it's because I'm hunching over breastfeeding. And there's this long sort of laundry list of issues that we think, wow, at 8 weeks, we oftentimes don't see this. Like we oftentimes see people coming at the 4-week visit being like, yep, so I've gotten out walking in the buggy and this and this and this. And right. So that can be kind of a flag. And that's where I launch in right away to tell me about the birth, right? Tell me about, what were the weeks like leading up to that? Tell me about the birth. What have the weeks been like at home? That's going to give me a lot of important context. And those oftentimes are the clients where, and I mean, I'm so lucky at the womb because we have this incredible village of every different kind of type of person you could need to support a woman. But that is usually a time where women need more help. They either need one of our social workers to help link them up with community resources. Maybe they actually had a traumatic situation happen through their birth, but they're actually so dissociated, they don't even recognize it. So there can be all these things that can happen. But generally speaking, if I'm feeling like someone's kind of on a good track for recovery, when I see them at that 4 to 6 week mark, I'm expecting that when they've come in, they are kind of excited to have the visit with me because they're wanting almost a little bit of clearance, from someone beyond their OB who they feel like sort of understands exercise a little bit better to kind of get on with it. They've already got out for walks with baby in the buggy. Maybe they've done a little bit of baby wearing and, for the most part, it's okay. But sometimes they're finding they're feeling pressure and they kind of have some questions about it. So they're coping well. Maybe they're saying they had some breastfeeding hiccups initially and a tongue and a lip tie had to happen. And that was really stressful. But at this point, they're kind of over that, right? So that to me is, okay, this is kind of looking good. And then we can kind of be moving people on. And that would also be the person who's asking me at that point about running. I'd be saying, you know what, you're already tracking in a really great way. Our guidelines at this point say not until 12, 13 weeks. So let's check things out and let's continue building your fitness so that we can be sure when you come back and see me in 6 weeks, we'll both feel confident from the testing that you're ready to start.
Right.
Right. So that's kind of what I'm looking for. But if we're seeing something sort of deviating from that, that's when I'm starting to really think of these other systems that are going to impact the healing.
Exactly. So I have a client who has prolapse and we're working with her and she's like, I'm feeling great. I can do these things. And then she came to me this week and I'm like, how are you feeling prolapse wise? She's like, oh, not good. I feel like I just backslid because my daughter wasn't sleeping and I was stressed about this and I had anxiety about this, but now that's over. Right. So yeah, all these things can kind of put a hold or a damper on that recovery. So
absolutely. And the one thing I'll say about this, because sometimes, you know, clinicians, fitness instructors, they can understand this, but they think, but like, how do I say it to a client in a really concrete way? Right. So they get it.
Yeah.
And so oftentimes what I will say about those types of contexts is I'll say, look, I know it can kind of feel like a little bit loosey-goosey, and frankly, it can feel really annoying to people when you're saying, well, your sleep is impacting, and they're thinking, yeah, but how am I supposed to sleep? Like like it can feel frustrating, right? And I think we need to acknowledge that and try to almost anticipate and problem solve around the realities of that physiology, because it's a biological reality, right? Yeah. But oftentimes what I'll say is look, you know, there are ways we can biohack around this. And we're going to go through those in a second. But at the end of the day, if we don't have good sleep, if we don't have good nutrition, like if we don't have basic needs met, our alarm system goes off. That's just basic biology. People can kind of understand that. So it means that one of the things that happens when your alarm goes off, one of the things that happens is your pelvic floor does this and your upper traps do this. They just do. Yeah. It's automatic. You're not doing it. You just telling yourself to relax isn't helpful. Yeah. It's automatic, right? So rather than getting frustrated about that, understand it. So that is why when we're in these states, we are going to notice our pelvic floor doesn't respond like it did. It can't. It's in a straitjacket. So don't expect it to, but try not to also get frustrated by it. And so like explain it to in these terms to say like, it doesn't mean you're going backwards per se. Yeah. It just means that this is happening. And the more we can actually be sending compassion and love to ourselves, actually that can help. Yeah. And one of my favorite biohacks when there's this crazy depletion that's driving up these symptoms is I'll say, look, at the end of the day, when we understand our energy system and our physiology and our cortisol and our stress hormone, we know in these types of states, it tanks around 3 o'clock. Yeah. Right. So if we at the very least can have some other grown-up responsible person in charge for 10 minutes, sometime between 3 and 4, and we can go into a room by ourselves, get our legs up the wall, and almost be like in a bit of a shavasana state with 3 minutes of just lateral costal breathing, 3 minutes of very gentle pelvic floor pumping, and 3 minutes of ankle pumping. Yeah. As a bit of a reset, as an energy reset at that time to recharge our battery. Right. It can make such a difference, right? So that's kind of my favorite biohack. Right. When people are saying, don't talk to me about my sleep. I know I need to get more sleep. I'm exhausted. And actually it's almost triggering for them to talk about it. Yeah. Right. And this is a reality. And to say, and I get that. And like, we all get that. Understand though, that's biology, right? Yeah. So understand that that is driving some of what's happening. So just understand it, but don't catastrophize about it. It doesn't mean you're going backwards, right? Right. But are there little hacks we can do to help you a little bit? Right. Right. And so that's kind of one of my hacks that I like. And people oftentimes will find, you know what? That has actually been a game changer, because I actually find I look forward to those 10 minutes. I actually found it was easy to get someone to step in for 10 minutes. You're not getting them to step in for an hour. Yeah. You're not, it's 10 minutes. So it's accessible, it's easy. And then because it literally is, we are doing all sorts of very deliberate things with the biology. Right. So it actually does kind of fill your tank. It can kind of get you through that really tough time. You've just gotten through the day and you're like, how am I going to even get dinner on the table? And how am I even going to, right? You're doing kind of a reset before that.
Yeah. Awesome. Okay, so to that end, we talked about back pain and other pains there. So you posted on IG 10 scientific facts about back pain that we keep getting wrong, and some
Yes.
widely held beliefs about back pain that are not true. And I want to
Yes.
focus on two of them today.
Yes.
Specifically, back pain is not caused by poor posture, and back pain is not caused by a weak core. So this is huge for me because with all of my postpartum clients, and my clients are probably 95% of them are postpartum, and they are new moms. A lot of them come with, back pain and these things. And so as soon as we start working on their posture, not mother hunching so much and opening their chest and working on strengthening their back and releasing some of those muscles and working on their core and their deep core, their pelvic floor. Denise, my back pain is gone. And so you're telling us that that's maybe one of those non-scientifically backed truths about back pain. So can you speak to those two? Because I know you have on IG. So
Yes, absolutely. So where that list has come from, first of all, it came from a series. So it was published by Professor Peter O'Sullivan, who's in Australia, whose group has been kind of working with back pain and pelvic pain probably for 2 decades now. And what's interesting about their group is when they initially started off with their research, they were talking very much in terms of the solution for back pain is destabilizing everything. But they were starting to find that that actually didn't play out in clinic at all, and it didn't even make sense. That led to more research and more research and more research. And now we're kind of at the point that we are now. So they sort of summarized this series that was published in Lancet, that was written by a group of researchers and physicians. It was 5 different articles really teasing out around back pain and coming to the conclusion that at the end of the day, we see it does not map on to a specific pathoanatomical tissue thing. It just doesn't. But so many of our strategies out there, even if we think of back surgery, are applying mechanical solutions to a problem that does not really seem to be mechanical, right? And so it's probably why people, it's hit and miss. It's people will go in for back surgery. This reason it's why so many back surgeons have actually left that field.
okay.
They'll go in for back surgery expecting a great outcome, and over half the time it doesn't happen, and it's because that wasn't the problem, right? So when it comes to these two issues, and I'm so glad we're going to talk about them because it's important, it's not to say that those adjustments that you mentioned, let's talk about posture first. It's not to say that when we actually get an enhanced relationship of tissues, right, that then we're going to have a better strategy. It's not to say those things. It's to say that lots of the things we're doing when we are considering posture, and I really think from the perspectives of us as trainers and physios, we're thinking about that more from the perspective of relationships, of structures, to actually have a better strategy of movement, right? So it's not to say that those underlying mechanisms that come along with considering posture aren't doing something useful. All of us see they do, right? All of us understand there's a lot of good reason why you would want to consider the relationship of structures. I mean, we know every muscle contracts on a length tension relationship. So even when we're trying to optimize power, for example, that's going to be important. But what we also know is that when we aren't considering those pieces that go along with posture, because now we're talking about impacts of motor activation and motor output, and like we're kind of mixing it all together.
Right.
So we're saying absolutely, there's great mechanisms there, but when we literally just talk about posture, we have kind of been led to believe that there are certain postures that are good postures. And this is really where this has come around back pain. And so what the most amount of data to substantiate this point, just to kind of make it clear for people, is really the notions around this type of posture that sort of goes hand in hand with bracing your abs. So in ways, it's almost like this core stability or core strength and postural thing. Those two things sort of feed together in a lot of the literature that has been analyzed for these points.
Okay.
And what the point is trying to make is to say, we kind of swung so far around, like, yes, is it unhelpful to be in the same posture all the time? That's unhelpful.
Yeah.
We know that. We know we have to be varying up our posture all the time. No one's disputing that.
Mm-hmm.
We also know that when we're sustaining positions at end range for sustained amount of times, that also generally isn't helpful, right? Generally, for longer periods of time, we want to be in neutral. We want to take tissue to end range.
Yeah.
We want to load tissue to end range. We want to flirt with the end range, but we don't want to sustain there because that actually can be aggravating. And so I think that's where some of the concepts around these kind of slumped postures, well, if you're truly slumped and sustaining that at end range for a long period of time, yes, that's not helpful. Right. But really, what a lot of the back literature is looking at is that swinging so far and pulled out of context to say bending the spine is unsafe. We should never bend our spine when we pick things up. We should have this militant spine. When we're sitting here, we should be militant. We should always be bracing our abs because everything's unstable. And actually, we find that makes things way worse. That makes people fear that they can't trust their spine, that their spine isn't meant to be bendy and responsive. That actually makes people think they should be putting energy into consciously restricting structures and cutting off blood flow, right? And we actually find those make things a lot worse. So when it comes to the posture bit, really it's more pointing to the notion of this notion of if you have back pain, you really should be holding this erect, militant sort of traditional posture. We know that that's not the case. We know that when we are just looking at sitting posture, that people sitting like this or like this, or people who shift their posture all throughout the day, it really doesn't change their pain experience. Because actually what we know really is more relevant to pain is more the inflammatory context. So when we get people moving in a safe way and optimizing their strategies to build more oxygen to their tissues, we're taking out the inflammation. We're having them less fearful to move because they feel stronger. And so even though we're considering posture alongside with those things, it isn't really the static posture that's the mechanism that's driving change. Because what we understand is when we look all the factors related to pelvic pain and back pain, quite frankly, we see they all relate to systemic inflammation, right? And so if we're taking, oxygen out of tissues because everything's too braced, that's not helpful, right? If we are having someone scared to move, so they're not exercising, that's not helpful.
Exactly.
Right. So it comes down to that. So I would argue we need to consider posture and relationships of structures, but kind of in a different way than we have. And we need to have people to understand that actually it's a range of postures that's good. So it's not to say, well, every time you sit at the desk, you should always sit like that. No. Be aware as if you're sitting there and your brain is telling you, you've been sitting in the same position for X amount of time, and our brain is going to try to protect us. So it'll kind of put a little bit of a signal in that area. And really all it's telling you is get up, change positions, and so our bodies really, if we start to understand, patients will often say, well, I get in too much pain if I'm sitting there for too long. And it's like, pretty much everyone will. And that's actually our body's design to tell you to move. We were not designed to sit there. So rather than you pathologizing that there must be something structurally wrong, or you must have to adopt some posture and get a special postural chair. No, just when that signal comes, that should be a reminder to you, you have to move. Your body needs oxygen. And when you come back and sit down slightly differently, switch it up. That's it.
I was going to say either that pain response or that Apple iWatch that's telling you to stand up every 30 minutes.
Exactly. And for those of you who don't have that Apple Watch, that pain response is probably going to be your Apple Watch. And rather than catastrophizing it and being, oh my gosh, I need to go in the chiro or no, like it's just your body's system. So when we're sitting, right, especially if we aren't sitting in an alignment such that we're sitting right on our sitting bones and our diaphragm is aligned right over our pelvic floor, like if we're sitting like this, and sometimes I'll sit like this, but I don't stay sitting like this. Like maybe 10 minutes later, now I'm kind of shifting off to the one side and now my legs are crossed and I'm going to be moving around, and then at a certain point I'm actually going to get up, right? But if I'm in this position, right, I'm slumped a bit. Well, now I'm not getting any of that automated pumping into my pelvic floor because
Right.
I've cut off the connection from the diaphragm to the pelvic floor.
Right.
So after a while, it's like there's going to be almost like a congested thing going on because now we don't have oxygen or pumping.
Okay.
And so probably that's going to tell me. And for me, my little canary in my coal mine is always my right sacroiliac joint. That's my spot. That's a spot I injured when I was doing a lot of long distance running in university. So that's kind of my spot. That's always just my cue. So I don't think, oh my goodness, my SIJ is acting up. That's my cue that I'm like, oh, right, I got to move.
Right.
Right. So I think, yes, alignment of structures and considering aspects of posture has a place. It's just how we contextualize it and the messages we send. And we don't want people thinking there is one perfect posture, that every time they should sit like this, that there's a specific way they should lift all the time. It's another thing. There have been studies and studies done saying, no, it's not more efficient to lift with a straight back. Actually, you can easily bend and it's not damaging with a curved back.
Right.
Another big one for people. You'll see all over Instagram. This is how you lift your baby out of the crib.
Pick up your baby. I do. I teach it too, right? Yeah. Pick up your carrier or your baby's car seat like this.
Right. And I would say what's great about that is so people have options, because if you have been picking up something with a curved back and now your brain interprets that as a threatening thing, and now right before you're going to lift, because it's the same way you're doing things, your brain's going to anticipate that as dangerous. Well, then we want a different input. Okay. Right? We want different ways. So it's not to say there's a problem of giving people strategies, but there is a problem of saying it's dangerous and bad to lift with a bent back when our data shows otherwise. Right. But people do need strategies. People's tissues are sensitized in different ways because of their previous experience and previous traumas that will sensitize tissues. So certain ways of lifting things might kind of trigger off, my hypersensitive sacroiliac joint for me, but not for someone else. So that just way of doing things just isn't a good fit for me. So I'll just do it a different way. Okay. Right. It's to acknowledge there's no right or wrong. I guess that's kind of what I'm saying.
Right. So what are, I don't know, the handful of psychosocial things that moms who have back pain, can do other than adjusting their posture and other than strengthening their core and thinking their core is weak? What are some things that they can do? Regular movement.
Yes, regular movement is one. Understanding sort of what we call their stress response system. So understanding if you are in a stage where you have a lot of stressors, right? You will likely, if you reflect for a moment, you will likely recognize, yes, I have more pain here, and actually I have more pain up here too. So be trying to think of, what can I do to do anything to get myself into parasympathetic nervous system response, ideally around 3 or 4 o'clock, right? So that can be a body scan. That can be legs up the wall. That can be an Epsom salt bath. Another really helpful thing when the tissues are very upregulated, which is going to be something that sensitizes the structures, is extra magnesium, right? So Epsom salts is magnesium, right? So even Epsom salt bath, or even at the time that you are going to get the most amount of sleep, like let's say you're breastfeeding, and so the most amount of sleep you're ever going to get is like this 1 4-hour stretch through the night. So that's kind of like your stretch of longest sleep. Right. Supplementing orally with magnesium bisglycinate before that, that will allow you to get into better repair, right? So thinking about that stress system, thinking about nutrition. Did we say about nutrition?
No, we haven't, but that's one.
Nutrient dense food that's easy to digest. So we actually say, like in that postpartum period, soups are actually the best. Yes. Because actually we need a lot of like warming foods after you birth your baby in your placenta. And soups are things that you can kind of consume on the go, like in an easy format. You're not kind of sitting there having to cut things. You're shunting way less energy to break all that food down. So you have better energy reserves, but you're also getting your fats, your proteins, your everything kind of in, right? So we want to be thinking, yes, anti-inflammatory things. So if we're dialed in the stress mode, what can we do to kind of chill out? Even just quiet breathing, is something that can help with that. We want to be thinking of even just the impact of tensioning the structures of our pelvic floor.
Right.
So if there's any type of movement or stretching, just to lengthen tissue,
Right.
I mean, that's another great thing that you can do. Time in nature is huge.
That's my next question.
Yes, time in nature is a huge sort of reprieve, reset, bringing your systems back to homeostasis. And so sometimes it is not possible for a mom to get time in nature by herself, right? Because if she is caring for multiple children, right? So sometimes it means the best she can do is at least just get out with the child of hers who will be sleeping
Right.
on her walk. So
Yeah.
at least she can sort of feel like she's off, like she's not on mom duty.
Yes.
And she can kind of attend to, what sounds do I hear? Like, what
Yeah.
birds do I hear? What are all the different? So it's very mindful, really concentrating on sipping up as much air and all the microbes that are in the air.
Yeah.
To really, that will help nourish your microbiome. That's another anti-inflammatory biohack. So time in nature, I mean, ideally by yourself, but if that isn't possible, you know, if you can kind of time it for when baby will be sleeping, so at least you're not on in mom mode and you can really reap all the benefits. I would say those would really be like the main ones.
Yeah, that's my favorite one. And that was my last question. I love being outside. And these days, lockdown wave 3, whatever you want to call it, homeschool with my kids, it's just like my stress has gone to here. And my favorite part of my day is walking outside, going to the pond, going to the bush. And I'm like, oh, it just makes me feel so much better, but I don't know why, but it does. And I'm loving that.
Yes, absolutely. So it's the anti-inflammatory effect of kind of all the microbes, but it's also too that the light, the natural light, helps to really stimulate our brain to understand, like, yes, this is daytime, and our brain actually needs that. I mean, we are designed to actually mostly live outside, and mostly we actually live inside. So we live very much in this like this mismatch to our biology. And the more we have mismatch, the more we have inflammation. So anything we can kind of be doing, you know, eating kind of more whole foods ancestrally, you know, spending more time outside, like any of those things are actually going to drive better homeostasis in our systems. And then of course the other piece is vitamin D. Vitamin D functions like a hormone, right? So it is hugely anti-inflammatory. It stimulates our cardiovascular system, our metabolic system, our endocrine system. You know, we need ample vitamin D on board for even our mitochondria to function well, our energy powerhouses. So again, like if you're outside, the more you can have like your skin exposed, so you can actually be synthesizing. So you're not slathering like sunscreen all over yourself or covering up everything. You know, we want to that's another thing. It's huge for your mood, huge for your mood. So that's another benefit. So absolutely, like time outside. That's huge.
Okay. Now I know why. Now I know why my body loves it and craves it so much.
Yes. And I mean, that's a good point to just finish off on. Most women, honestly, their intuition will actually tell you exactly what you need. So your body's intuition is going to tell you everything. The trouble is we oftentimes don't listen to it. We are living in our busy mode. We have so many barriers, we don't even hear it. Or we hear our body telling us something, but we misinterpret it. Right. And we think we need to seek out something external to us to kind of address that, but usually we don't. So our body will our intuition will tell us you need to get up. You know, your intuition will tell you, even coming back to pregnancy related pelvic girdle pain, someone will say, well, why is it when I'm standing on one foot that's where I get so much of a problem? Well, as your center of mass is changing, you are at more of a risk of falling over when you're on one foot. Don't you think that's a pretty smart protection mechanism for your baby, just to say, mommy, don't do that? You know, instead, just sit down first on the chair before you take your pants off. Like it's just a protection mechanism. Your intuition will just tell you. Your intuition will tell you, get outside. Your intuition will tell you at 3 o'clock, you're done. You are done. You need to go into a quiet room by yourself. But we push through. We don't listen. You know, as we're running, our body will start leaking urine and it's telling us, we probably don't have either the energy reserves for this, so therefore our mechanics aren't functioning properly, or maybe we don't just have the mechanics for this.
Right.
We should probably stop, but instead we pad up and we run on, right?
Yeah.
So again, like that intuition piece, our women's intuition is so wise. It is so spot on. It's really exciting that our data is finally starting to substantiate actually what women have been saying forever, and have been kind of like brushed off. So this is why those times in nature, and even those times almost in a shavasana, can also be helpful, because it's time that we can be very quiet. We can just be, and it gives us an opportunity to actually listen to that voice that usually is going to tell us exactly what we need to do, like really and truly. So yeah, I think that's a good point to finish off on.
Awesome. Well, thank you so much, Dr. Sinead. Can you tell the watchers, listeners, where to find you and how they could work with you?
Yes, absolutely. So I am the director of pelvic health physiotherapy with The Womb, the world of my baby. So we have 4 locations in Ontario. I run my clinical practice out of our Burlington site. Okay. So certainly, you know, people can kind of find me through The Womb.
And I'll put the links in the description box down below as well.
Yes, absolutely. People can also find me on Instagram, as I'm always trying to kind of translate knowledge, and that might be helpful. And you could certainly DM me that way. Yeah. If you are interested in learning more details about pregnancy-related pelvic girdle pain, I teach a course, and it is also appropriate for fitness professionals through a company called Reframe Rehab, and it's specific to pregnancy-related pelvic girdle pain. It's an 8-hour course broken up into 2 4-hours on consecutive Fridays. I also teach a course on diastasis rectus abdominis, and this is a self-paced course, which is sometimes a nicer format for people. It's not online live. And this is through a company with Bia Formation. So it's a course that will give you everything you need to understand. It's a very in-depth course about DRA, but tons of videos about exercises and assessment, and much of the assessment actually fitness providers can do, right? So, you know, if you want to know more about that, that's a course also through Bia Formations, but those would probably be the best ways to kind of connect with me.
Awesome. So everybody from moms looking for help, and then practitioners, trainers like myself can reap some of your knowledge as well. So
absolutely.
Awesome. I thank you so much for sharing your knowledge with us today.
Okay. Well, thank you for having me. Bye, everybody.
Bye.